everyone. After a good lunch, I request all the delegates to come into the hall so that we can start the session. I request Ganesan to join me on the dais to moderate this session. So I invite our old team person, Dr. Gopinath, onto the stage, please, for his talk on on-field injury management, a physical demo.
Good afternoon, everyone. Being this post-lunch session, I think everyone will be a little sleepy and tired. So let's start the presentation with a video. Volume up, please. Volume up. Right.
Lucas Vázquez, línea de fondo central, Lucas Vázquez, Cristiano, gol, 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 gol de Cristiano Ronaldo. Gol, el sexto del Madrid, el segundo del portugués que ha quedado dolorido, un golpe en la cara de Cristiano Ronaldo.
That's a preamble of what I'm going to address today. Good afternoon, everyone. I'm Dr. Gopinath from Chennai. So, first of all, I'd like to thank Dr. Divya sir, Dr. Santosh Anand sir, and Dr. Sham for giving me this opportunity. No matter the sport, no matter the arena, no matter the level of play, or no matter the age of the athlete, there is always a game plan for success. Am I right? So, sideline preparedness is an essential part of game plan by the team physician, be it a physiotherapist, physical trainers, or the coaches. It is essential to organize a medical timeout meeting, which is a meeting between the officials and healthcare professionals to discuss the emergency action plan in case an athlete is injured and the decision to be taken whether he is to be shifted to a nearby facility or not. So it's always good to be prepared for the worst case scenarios. So always be prepared, know what to do before you have to do it. So as a team physician or a therapist or a trainer, you need to be vigilant because each and every athlete of your team is very important. Their safety is very important. So whenever you attend a game, get to know about the game dynamics, get to know the players, observe every player because injury is very crucial. And moreover, when understanding the dynamics of the game and knowing the commonest injuries associated with the game, you can handle much better. And witnessing the mechanism of injury is particularly useful in case of any concussion or any other limb-threatening or joint-threatening injuries. And in such cases, you can call for help, and the primary evaluation can be done by the team physician, and if it's deemed necessary, you can shift the patient out of the field. So recognizing the injury requires constant observation of the player on the field, as I told you, and observe the player position in case of injury, the position of the limbs they kept in, the level of consciousness, and if it's suspected to have a head injury, then you can shift the patient off the field. So for instance, if a patient is lying unconscious or motionless, whether conscious or unconscious, always stabilize the cervical spine because it's a very crucial part. Faulty handling techniques can lead to catastrophic events or even life-threatening conditions. And then check for the ABCs and make a transport decision. But if the athlete is sitting upright and responsive, you can assess for the red flag signs and see whether he is responding. And assess for the following points like neck pain or tenderness or limited range of motion, double vision, weakness, tingling or burning arms or legs, severe or increasing headache, seizures or convulsions, loss of consciousness, deteriorating conscious state, vomiting, and combative or agitated behavior. As a part of 3-minute concussion rule, if a player is suspected to have concussion, the referee can summon the team physician to come onto the field and assess the injured player. So there's a form called Sports Concussion Assessment Tool, which is an essential tool and it needs to be kept in handy, which is assess the 4 main domains of the player, that is orientation, concentration, memory, and balance. So this form, when kept in handy, it will be very useful for us to assess the patient if at all he's encountered any concussion. So just an outline of this form. It's very hard to memorize all the points. So when kept in handy, you can just follow the instruction kept in the form. So if at all that's a red flag sign, then you can shift the patient immediately to a nearby setup, or else you can follow all these points given in the form and then assess the patient. There are some standard MADOC questions given in the form, like which venue are we playing today, which half of the game are we playing, and who scored last in the game, assessing all the memory power of the athlete. If he's able to answer all the questions, he can be let to play, but again can be monitored for any delayed signs of concussion like being out of his position, deteriorating from the play, headache, dizziness, nausea and blurring of vision. But if the player does not answer any of the questions, he is not allowed to play the match. So apart from concussion, you can also encounter some vascular compromise injuries, open fractures, dislocations, neurological compromise injuries and overlying skin integrity conditions. In such cases, you can, after ruling out the concussion, you can remember this mnemonic, which is toe taps. You can go and talk to the patient, like what does he feel, like how does it hurt, where does it hurt. You can, asking these questions will come over experience, and moreover you can have a basic idea where he's got injured. Then observe the patient, look for any deformity, dislocations or any bruises or open injuries over for the patient, and then gently touch the patient, gain the confidence of the athlete and just gently touch and palpate for any obvious point tenderness. Then if at all everything is ruled out, if you can't find any obvious deformities or dislocation, then ask the patient to actively mobilize his joint as long as he doesn't have any pain. If he's able to move the joint, that means he is quite okay with it, but still needs to be confirmed with the further investigations. But if he's not able to move, that deems it is a very serious injury. Then you can also ask the player a simple mechanism, like ask the patient if they're able to stand after the fall. If at all there's an obvious fracture or dislocation, the patient won't be able to stand after the fall, especially in the lower limbs. Then he cannot be allowed to play the game. So these are the basic things you have to follow. So right now, by chance, if the player is not able to get up from field, he has a serious injury, he needs to be shifted. So for shifting the patient, we need a team, right? So you need to know who are in your team, who are responsible for shifting the patient, who's going to carry out the medical aid kit, and what are the equipments needed for shifting the patient, and what are the transport facilities has to be decided priorly. So let's see how we safely shift the patient efficiently off the field. I'll show you a video right now.
எந்த ஒரு விஷயத்தையும் பிளான் பண்ணாம பண்ணா இப்படித்தான். பிளான் பண்ணி பண்ணணும். ஓகே.
Yeah. So now you have all systems in place, but we don't have any prior rehearsal or practice. So still, if you have all the systems, like every staffing on hand, if you don't have a proper planning, it's going to fail miserably. So this was a paper published in AOS on the consensus statement of sidelight preparedness by team physician, where there's three headings, like medical protocol, administrative protocols, and on-site medical supplies, whereby you can study and make a protocol for ourselves as local policies, addressing whatever can be done from our side. So as a part of medical protocol, it's not only the injuries which matters on the field. Sometimes it's also essential to know the medical background of the athlete, because they might be an asthmatic, they might be diabetic, they might be patients of seizure fits disorders. So you do not know. So always get to know, have a practice of preparing a pre-participation evaluation form where you know the medical conditions. You can make arrangements for the medical drugs. If in case of any emergency, you can have it handy. And apart from that, as a part of medical protocol, the medical team orientation should be there. You should know who is in your team, and moreover, you have clear-cut defined roles, because everyone should not be carrying same equipments to the ground. So it will be a chaos out there. And then always get to know a nearby facility connected in case of shifting athlete to a higher care center. For example, how many of you are from Ooty or Kunnur? Yeah. So here in the city, like in Chennai or Coimbatore at least, we have a nearby medical facility, right? But in Kunnur, we don't have such facilities. Medical facility over there is a little, it's quite inefficient or deficient. So in such cases, if at all you have athletes in Kunnur or playing, if at all you require medical support, it's better you approach or set up, like we do have a setup in Kunnur, Ortho-One center, so that you can at least priorly inform us that we're going to have a tournament, you can come and give us support. That will be like in case of emergencies, like you can utilize the support. That will be much more better planning. So as a part of medical protocol, always get to know, do you have a medical support nearby? So in case of emergency, you can shift the patient safely to a nearby center. So next, as a part of administrative protocol, as I told you, you should be vigilant. As a physician, you should be vigilant, watching the game carefully. So you should identify priorly where the physician can sit and watch the game clearly so that he can observe in case of any injuries. And then identification or prioritizing a place where you can treat the patient. In case of an injury, you should know where to take the patient to a sideline. You should arrange some medical aid kit or a room for the player to be examined apart from the game, outside the game. And then arrangement of medical staff. Like, you know, you do have a team, but you should make arrangements and make some convenient access to the field so that they can go and access the athlete and bring them out of the field. And then, most importantly, always make a rehearsal before the game itself. You should define roles and ask them to rehearse themselves, rehearse their roles so that they will do a better job. So this one such form is always essential. So because it's very crucial to handle a huge tournament, right? So it's better to have a timeout checklist sheet. Like if you can see here, you can see the pre-game operation agenda. Like you can define the roles of the team. You can have a checklist of what all you require, like spine board, an oxygen or a hemorrhage handling kit, spine immobilization procedure. All these things can be priorly checked out. And also you can have details of the nearby hospital details so that in case of emergency, you'll always be ready. So you don't miss out anything on the day of game. It's a very crucial day for everyone out there. So coming to on-site medical supplies, always better to have a spine board and a hard cervical collar, because as I told you, the most crucial injury is the cervical spine, and faulty handling techniques can lead to catastrophic events. And apart from that, limb-threatening injuries, you can immobilize them with some pneumatic immobilizers right now available in the market, so that if at all you suspect a limb injury, you try to immobilize the limb as a whole. For example, if you suspect a fracture in the one particular bone, immobilize the joint above and joint below, so that the patient doesn't have any pain while shifting. And apart from that, you can arrange some medical kits. And an epistaxis or bleeding from the nose is a quite common injury. So in case, you can try to give compression by pinching over the nose. If it doesn't stop, you have some options like packing the nose with some tampons or nasal packing equipments. So that's with the first aid. So from now on, I'm going to show you some pre-recorded videos of injuries. So as a spectator, you can just visualize the video and come with your own differentials and tell us what would be the possible injury and what shall we do about it? How do you handle it? So first case, you can see martial arts judo where the player is falling down. So let's again see it in slow motion. Anyone can answer, like you can come with a game plan, like what is the probable injury and how do you handle it? Yes. Anyone? Anyone can volunteer? Yeah, please. Yeah. Yeah. So from the type of injury you can see, it's either going to be a clavicle fracture or ace joint separation because of a direct blow over the left shoulder. So again, the kid is keeping his hand over his shoulder. Unless, again, from now on we have to have a game plan like how to evaluate the patient. So you can take him to the sideline, you can strip off his shirt and look for any deformity, any fractures or abnormality or bruises over there. And in case, if you have some doubts, then you can shift the patient for radiology investigation and confirm the diagnosis. So that's with the case 1. So coming to case 2, this is quite a common video, and today it has been played almost 3 to 4 times. And there's a one-day international in England against where you can see Rohit Sharma dislocated his shoulder and relocated himself. From the way he relocates his shoulder, it seems like he knows about it already, right? So here, in an event to stop the ball, he overexerted himself and dislocated his shoulder. But he was very, I think he's a fan of Vijay. Because I've seen it somewhere, right? This kind of action I've seen it somewhere. Let's see. Yeah. But not everyone are lucky every time, right? The same way he was not lucky the earlier time. This was an older match in 2020, but then he was not lucky. He was forced to he was taken out of the match. He was treated by a team physician. His shoulder was stuck very bad. He was wincing out of pain. He was not able to continue the match. So, what is the difference between these two events? Sorry. Anyone? The first one was, there are 2 different episodes, right? Anyone? Yes, sir. Yes, sir. Pardon me? I didn't get you. Okay. 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 Yeah. He got used to it anyhow. But will it be does he requires any sort of investigations or any sort of treatment? Yeah, but what is he undergoing surgery? No, by far no. We don't have any evidence. So it's quite an unstable shoulder. Again, it's about the team physician decision whether he has to be given immobilization rest or any surgery. So here, next we will go for the next video. Yeah, the third video is an international Netherlands player, Van der Horst. So you can see he got a direct impact with his right shoulder. Another video in a different angle. Yes. So in this case, what would be the probable diagnosis? Pardon me? No. So here you can see it's a direct impact and the shoulder was not stabilized. So probably he would have, and sources said that he ended up with a lateral clavicle fracture. So in such cases, so we should know what sort of injury it is and how we are going to manage this patient, how we are going to shift the patient off the field. So in such cases, when the patient is very painful, if you have to shift them to a nearby hospital, you need to know, at least if you have arm slings or any support service, orthotic devices, like you can immobilize the patient, or else you can make a sling by yourself. This is a small training video where you can see how to make a sling with available sheet. So here you can see you can use a triangular piece of cloth. The apex of the cloth can be kept behind the injured elbow, and the long arm can be kept over the opposite shoulder. And then you can make a sling by just rolling the bottom end of the long arm behind the shoulder and making a knot. You can ask the patient to stand upright so that the arm suspends by itself by gravity, or the player can help himself by supporting the arm with the opposite normal limb, and you can make a knot. Thereby you can shift the patient safely to a nearby setup where you can be evaluated with radiological investigations. So a take-home message is you should always be prepared for worst-case scenarios. You should know how to mobilize a patient, transport a patient safely, so that you can be evaluated further. So safety of patients is more important. Thank you.
Thank you, Dr. Gopi. Before you go, it's better that we have the discussion here now and then, because people should not forget about the importance of this on-field injury management. You had mentioned about the SCAT-5 program.
Yeah.
Now, are coaches validated to do this program, to checklist?
Yes.
Okay.
If they're given proper training, if they can assess, you have to read, keep the forms handy. So it's a very quite simple form. You just have to follow the instruction. You can just check for any symptoms. Everything is given in layman terms like headache, vomiting, nausea. So you can be aware of what are the symptoms the player is. You can just give a checklist. If the patient clears of the form, then he can be allowed to play, or else he has to be kept on reserve.
Yeah. Just to add upon this SCAT program, it's available in British Journal of Sports Medicine, free downloadable version. But most important thing is, we need to know who's legally allowed to do these kind of scoring. Now, an orthopedic surgeon and a physiotherapist is permitted to do the SCAT-5 program, which is the advanced level, because they know the medical terminologies. But if it's a coach or a physical education trainer, they cannot do that. What is you have something called the SCAT Basic checklist programs, the things which you need to check, and then you have to validate whether the athlete can get back to field or not. So the SCAT-5 program is restricted to the physiotherapists and doctors, whereas we have the SCAT Basic, which is for the coaches and physical education trainers.
Yeah. What I kept here was SCAT-2.
SCAT-2, okay.
The other point which I would like to add is SCAT-5. The ICC guidelines also mentions that you see whenever a cricketer gets hit in the helmet, they stop the game, they come and ask questions. The questions is something like that. But when you are questioning an athlete, when you know the athlete before, they might ignore your questions. They say, I'm okay, but you should not stop. It will be simple questions like count backwards, add 2 numbers and mention. They'll be laughing and say, I know, but you should persist and ask them to answer it correctly, because that might be the only thing which is positive for concussion. If they're not able to tell that backwards, you cannot let them continue the game.
I would like to quote on a very important incident which happened. When I was training in Australia and Sydney, I was the team doctor for Wollongong Warriors. They the rugby matches. These are the hefty guys, just like New Zealanders, very rough fellows. They had a contact injury, and one person had a contact injury, had a head injury. He was brought to the examination table, and I was asking him some questions, and he had a laceration on his forehead. So I told him that I need to suture the laceration, giving a local anesthesia. This fellow said, no, I'm absolutely fine, just suture it directly, don't give me any local anesthesia. Then I just waited for 5 to 10 minutes, then I reassessed his condition, he was losing out on his consciousness. So when they do not respect or they do not listen to your commands or your instructions, it directly means that something has happened, some sort of a concussion has happened to his brain, and you should take the necessary steps as early as possible. So an uncooperative athlete is the earliest warning sign for a severe concussion injury.
Any other questions? Please.
About familiarizing the SCAT 2 or SCAT 5 with the players themselves. What will be expected to be answered if they encounter a fall or an injury?
That is usually has to be done in the team management protocols. It's not been followed. That's a problem.
Okay.
That usually has to be done. Yeah.
I think that will be more, more fruitful when an incident happens.
Yeah. Compliance with SCAT program is important, but familiarizing each and every aspect of it is not really good. Sometimes they are used to doing it so many times, it's actually something to test their concentration, but it will come from and memory. But if they are used to that, they know what questions they are going to ask, they know the answers, they'll just blabber it out. So it has to go, familiarizing too much is also not good. But the person assessing it must keep changing the questions so that they are not too familiar with the questions.
Yeah, maybe changing the order of the questions.
Yeah, something like that. It should not be the same routine which is repeated. It should be slightly different from each time.
Thank you.
Thank you, Gopi.
Thank you.
Any other questions? Please go ahead, Gopi. Thank you. So now I invite upon our next speaker, Paul, who's going to talk about return to play. So this is a very important topic. We've seen what injury has to be managed acutely. So after injury, a long-term rehab, and when do you really allow the player to go back? What are the criteria, Paul?
So good afternoon, everybody. I'm Ernest Paul, orthopedic physiotherapist from Ortho-One and Abhinav Bindra Targeting Performance. Today I'll be talking about the most frequently asked question by an injured athlete. When can I play? So today I'll be discussing about the criteria for return to play. So before I start my presentation, I would like to ask you 5 different questions, okay? And the answer for these 5 questions will be the take-home message from my today's talk, okay? So right from the beginning of my talk till the end of the talk, I want your 100% attention, right? Shall we start? So my first question is, what is a 3P program? Anybody? I'll just give you 5 seconds because I don't have much time. Anybody? Okay. My second question, name some functional tests for shoulder. So
there are surprise gifts available for any correct answer.
Yes. Name any functional test for shoulder. Those are movements. Any other functional tests? Somebody over there. Excellent. Dr. Deepak has answered. And question number 3, what are the factors that should be considered before conducting an return to sport assessment? Any factors? Limb symmetry index, good. Any other answer? Okay, we'll go to the next one. Can a single test battery be used to assess the athletes of different sports having shoulder injury? Can a badminton player be used the same test battery like a basketball player? Yes or no? Simple question. No, yes. Okay, and the question number 5. Name a test relevant to the following sport. First, badminton. Can you name a functional test which is relevant to badminton? Okay, swimming. Okay, gymnastics. Okay, answer for all these 5 questions will be seen in my presentation, so listen carefully. So first, let us start with 3P program. So you have to understand the transition from the rehabilitation to the return to sport has 3 stages. One is return to performance. And second thing is return to practice. And the third thing is return to play. First is performance, second is practice, and third is play. In return to performance, the athlete is physically active, but he cannot return to sport. And in return to practice, the athlete resumes his practice, but he cannot give his 100% effort. But in return to play, he is 100% fit, he's physically active, and he performs at same intensity as he or she did before the injury. This is 3P program. First P is performance, second P is practice, and third P is return to play. Now there are 6 major factors to consider in return to sport. 1, when designing a return to sport plan, there should not be any pain at all. Okay. The second thing is the active range of motion should be pain-free, and it should be sport-specific range of motion. And we have to evaluate strength, power, and endurance. All the 3 components has to be evaluated. And the fourth factor to be considered is evaluating the kinetic chain integrity. Okay, and the seventh one is psychological readiness. Is the athlete mentally ready to participate? Okay, and the last component is sport-specific demands. Okay, we have to evaluate all the fitness components involved in the sport. Okay, when talking about the return to sport test battery, there are more than 30 functional tests for shoulder, more than 30, and there is no standard test battery for return to sport assessment. No standard test batteries. Okay, but we have to design the test battery based on the type of sport. See, the sports involving the shoulder can be categorized into 3. There are 3 types. Okay. The first thing is above shoulder height with or without throwing. For example, your badminton, volleyball, handball, baseball, all these are the sports which involve shoulder, but the movements are above shoulder height and with or without throwing. Below shoulder height with or without throwing, it's golf, basketball, squash, table tennis, football, goalkeepers. And the third, reverse chain sport. This involves swimming, gymnastics, climbing, and diving. So based on the sport, we have to design the test battery. So now I'm going to show you some functional tests. So you have to pick and design a test battery. Okay. The first thing is sport-specific range of motion. We all talk about range of motion, but sport-specific range of motion is very, very important. And it should be pain-free and it should be full. Okay. Check for glenohumeral internal rotation deficit. Okay. And check for total range of motion deficit. Okay. If there is if there is good, but if it is compensated with external rotation gain, there is no problem. But if there is a deficit in the total range of motion, then there is a problem. Okay, this is the first thing. Second thing is strength testing. We have got 2 amazing devices for strength testing. One is isokinetic strength testing device, which gives you the details about the peak force produced by the muscle. And the second thing is handheld dynamometer, which gives you the detail about the isometric strength produced by the muscle. These are the 2 devices which we use for strength testing. And the next functional test is ball drop test. Okay, this is used to evaluate the endurance, strength, willingness to move quickly, and the stability of the upper extremity. The athlete will be completely outside the couch. The testing arm is abducted to 90 degrees, continuous ball release and catches are performed, and the number of repetitions done within 30 seconds is recorded. Okay, and it is compared with the opposite side. The next test is wall throw test. The patient stands facing the wall and arm is abducted to 90 degrees, and continuous ball throws against the wall and catches are done, and the number of repetitions and the quality of movement is recorded. And this is, again, we have heard about kinetic chain assessment. So for kinetic chain assessment, we do 2 tests, single leg squat and step down test. We have to check for movement quality, if there is any deviation in the trunk, if there is any deviation in the lumbo-pelvic hip complex, and if there is any imbalance in the lower extremity. This is not directly linked to the shoulder, but again, we all know kinetic chain is important for shoulder performance. And next is softball throws for distance. Again, athlete sits against a wall and throws a softball with maximum effort, and the distance is recorded. And the next is push-up test. The athlete performs a standard push-up, and the number of repetitions done in 15 seconds is documented, and the movement quality is also documented, and this is mainly for strength assessment of the upper extremity and core stability. And pull-up test, again a standard pull-up is performed or a modified pull-up for a female athlete, and the number of repetitions for 15 seconds is recorded. Okay, and compensatory pattern is also recorded. Flexed arm hangs, it is again an alternative for a pull-up test. Those who cannot do pull-up tests should be given this test. It again tests the endurance of the upper extremity. And this is seated medicine ball throw. The athlete performs a counter movement and throws the ball within maximum effort. The distance is recorded. And again, it is for power of the upper extremity. And also it tests the kinetic chain integrity. And this is again closed kinetic chain upper extremity stability test. The athlete will be in a push-up position and continuous cross-body touches are performed and the number of repetitions are recorded. Again, it tests the stability of the upper limb, core stability and agility. And this is 1 RM bench press test. The maximum load which is lifted for 1 repetition, the load lifted is documented. This again gives you the strength and power details of the upper extremity. And this is unilateral maximum chest press test, similar to bench press test, but it is done with a dumbbell and it is done with a single hand. And the load lifted and the number of repetitions is documented in case of while measuring the endurance, and number of the amount of load lifted is documented and it is compared with the opposite side. So again, unilateral pulling assessment, we use ISO-Shift device. It's an advanced sports testing device, fitness testing device, which we have at Ortho-One through Abhinav Bindra Targeting Performance. Unilateral pulling assessment to check the pulling power and endurance. And this is again a unilateral pushing assessment. The unilateral pushes are performed and the number of repetitions and the load pushed is documented. Okay, and this is upper quadrant Y balance test. Again, in the Dr. Vinay's talk, we saw that the athlete, it is similar to lower quadrant Y balance test, but the athlete maintains a single unilateral stance on one upper extremity and the other upper extremity reaches in 3 different directions. One is medial direction, another one is superolateral, and the other one is inferolateral. And the reach distance is recorded and it is compared with the opposite side. So this is single arm shot put or single arm seated medicine ball throws. It is similar to seated medicine ball throw, but it is done with unilateral, one hand. And this is upper extremity hop test. This is mainly to evaluate the power of the upper extremity. The athlete does some plyo push-ups on an elevated platform. The number of repetitions for 15 seconds is documented. So apart from those functional scores, we also do some subjective scoring. So for micro trauma like impingement or tendinitis, Curl & Job Orthopedic Clinic shoulder and elbow scoring is done. Second, for macro trauma, Western Ontario Shoulder Instability Index is used, WOSI score, that is used. And for kinesiophobia, for fear of movement, Tampa scale of kinesiophobia is used. So now we've come to the important part. So return to performance criteria, the first stage. There are 8 criteria in all the 3 stages. First thing is return to performance. The healing time is important. There should be appropriate time from the injury or surgery for healing. That's important. Second thing, the athlete should have completed the formal rehab program. And the third thing is there should be full sport-specific, pain-free, active and passive range of motion. And special tests, there should be good stability, there should not be any pain or apprehension during the special test. And the 5th one is strength, there should be satisfactory strength. And functional scores, satisfactory scores on functional tests, and subjective scores, there should be acceptable patient reported subjective scores, and there should not be any apprehension or kinesiophobia. Got it? And this is the second stage, return to practice criteria. When can he resume his practice? So WOSI score should be more than 90. Okay, range of motion, again, it should be full, sport-specific, pain-free, active and passive range of motion. And clinical test, there should not be any positive findings. And ball drop test, there should not be more than 10% deficit. And push-up test, there should be improvement in repetitions. And closed kinetic chain upper extremity test, the repetition should be more than 21. And in bench press test, there should be 75% of pre-injury 1 repetition maximum, and unilateral push-up and pull-up test, there should be 95% of limb symmetry index. When comparing the affected and unaffected side, there should not be a difference of more than 5%. And this is the third stage, return to play criteria. Again, WOSI score, it is 95. Range of motion, again, full, pain-free, active and passive range of motion. Clinical tests, no positive findings. And ball drop test, again, there should not be any deficit. And push-up test, again, from the second stage, there should be improvement in the repetition. And closed kinetic chain upper extremity test, the score should be more than 25. And in bench press, the 1 RM should be more than 95% of pre-injury state. And unilateral push-up and pull-up test, they should be 100% limb symmetry index. Okay, shall we revisit the questions again? You're ready? Are you ready, guys? Okay. My first question, what is a 3P program? Performance, practice, play. Excellent. There are 3 stages. My second question, name some functional tests for shoulder. Yeah, ball throw, seated medicine ball throw. At least 3 more. Come on. Push-up test, then 1 RM. Anything else? Okay, great. So pull-up test, push-up test, closed kinetic chain test. Okay. And question number 3, what are the factors that should be considered before conducting RTS assessment? Any 3? Pain, excellent. Range of motion, good. Strength, endurance, power, those components. Kinetic chain, yeah, psychological readiness and sport specific demands. Great. And question number 4, you all know, can a single test battery be used for all sport? Never. Yes. And the last question, name a test relevant to the following sport. Badminton, any specific test? Imagine this movement. Ball drop, softball throws. You guys agree? Okay. For swimming, what do? When they catch the water and what do? Pull. Pull-up test? Great. And for gymnastic, it's a reverse chain sport. Gymnastic, yeah, Y balance test, upper quadrant Y balance test. Badminton, overhead softball throw, swimming pull-up test, and gymnastics, any closed kinetic test can be used. Okay, thank you so much.
Thank you, Paul. You scored more pre-session scores and the post-session scores. They definitely improved. So credit goes to you.
Thank you, sir.
Any questions from the audience side? Doubts, questions? Yes, please.
So everything has an evidence, but for Indian population there is no normative data. So it is in our hands to develop a normative data for Indian population and perform it. Yes. Thank you.
Thank you. I invite upon. Yes, yeah.
Assessment and we see there is some lag. He's still being able to play. So these are decisions where I think as an experience we make, saying that yeah, you can continue the play but be careful on some of the areas. And as Paul mentioned that there are tests which we look for stability based, the power based or the mobility based. So again it's the choice of test what we need to do. And what he was asking about the evidence based. Now evidence based, they pick one test and they do. Now when I know that this particular athlete, this test, I need to do the other test. And athletes are also smart enough. When we do the first time they do a test, they know this is the test they are going to repeat. So we cannot use the same test battery, we need to use the different test and then come to a conclusion of that. So that will be our decision making, how we make to find. So any points on that, sir?
Yeah, that's true. But there will be a chance of injury if you do not attain all these. These are foolproof. But if you're short of that, there is always a chance. For example, on the contrary, for example, limb symmetry index of 100% while they return, we hardly see 100% of return limb symmetry when they start to play. But we have to keep warning them that you're still not okay. It might not be good enough to get back to competitive level. You need to attain.
But we'll not say don't play. We play.
Competitive. Return to practice and return to play. There is difference. So we have to keep warning them, but there is always a chance of re-injury. So we have to drive that in for them to attain whatever criteria are there. These criteria are also arbitrary, right? So it's not foolproof. So these are just objective guidelines. Otherwise, it used to be only subjective. We have something objective now, so we have to probably over time know more with these equipments which are coming up, testing them in our population. Other things probably we should move forward. As you said, all the numbers which we have is for Western population. We don't have numbers of Indian population. So those are the areas which we need to work on, publish data, and then probably get more values out of it.
So I would like to add one more point, sir. So this return to sport criteria or testing will not help us in predicting the injury, re-injury. So it will give us the detail about the current fitness status of the athlete. If he is lagging in something, we can help him improve. That's all. Whether we can clear or we can just tell him if he is ready to play or not. We cannot predict re-injury with return to sport assessment.
What is the fitness state of Dhoni right now?
So he
Fit to play, sir.
This is always.
He's limping.
He's fit to play.
He's
fit to play, not competitive level.
That's again a controversial. If you ask Rohit Sharma, he's also he's actually.
So that's the second shoulder injury. Still not gone for surgery. So it's still playing. So maybe we don't know if we pick a particular test, he might fail.
Question is competitive level.
Dhoni is competitive level, fit to play.
Yeah, his values in the team, his asset to the team at that situation, his career level at that situation, all that comes into play. If they go on, suppose if Rohit Sharma goes on to do a surgery, he's out for 8 to 10 months. So he's the captain now. So he cannot compromise that. But he's able to bat efficiently. He stopped bowling. So bowling is not key for the team currently, means he's okay.
Okay. So which means, say for example, if Dhoni is having a serious knee injury, he is limping, he is not able to take the runs quick by running, he is scoring through 4s and 6. But his overall performance seems to be much better. So the knee injury seems to be insignificant.
Yeah, his asset to the team currently, his values of a captaincy, keeping is not compromised. The team management is good enough that he stays there for 2 overs is enough. Then
so does a physiotherapist considers these things in making an athlete fit for a game?
So if he was a young player, definitely I wouldn't have allowed him to play. This is his last season and his presence is very, very important. So, and he
put yourself, right, okay. Dhoni, age 25, same injury, same scenario. What would you do?
I wouldn't allow him to play.
Even being the best captain, an asset to the team, taking him out of the team will be a compromise?
This is a team decision, not the individual clinical decision. We inform the player that this is your thing.
What is the decision making of a physiotherapist?
We give them that this is your problem, this is the outcome if you don't stop or if you continue or those things. We give those outcome and then the decision is made by the player. Management. The coach knows everything. Okay. No, it's the individual player. We give him all the things. The management will tell, okay, how many matches to play, everything, and then they make a decision.
Okay. Yes, please.
Myself and Ganesh, we were working with Chennai Cheetahs, right? 2015, a hockey team, the World Series hockey. There was a player from Punjab, and Ganesh assessed him, and we said he's not fit enough to play. And we said he's not ready to play for the next game. And I did some fitness tests. I don't know if you remember. And then we told the coaches, we told the managers. End of the day, it's about match fees day, right? So the coach, the manager used his influence, told the coach, who was a Spanish coach, he was saying, I will listen to the physio. But the manager being the Indian manager, he wanted to use his influence. He made the player play. And I still remember it. I could even literally hear the sound of hamstring tear, and he was out for 8 months within 5 minutes. So whose is the decision making? Unfortunately, right now in India, physios and trainers have not been given that much leverage and power by the coaches to take that decision. Until that changes, we're going to have this debate.
Totally agree with you. Totally agree with
Sir, your point, contrary point from sir as a coach.
No, so talking about top level is different, but return to play is, rehabilitation is important. That coach decision. That's my opinion.
Once again, thinking about the Australian team, which I was the team doctor, I was given a free hand, and the instruction was clearly given to the players that if you misbehave with the team doctor, if you do not abide by the rules and regulations which the team doctor says, you can be thrown out of the match. That's the power of a doctor and even a physiotherapist abroad. Whereas unfortunately in India, that's not so. That's a problem.
Here I am talking about return to play. There is only rehabilitation is very important. That is only coach decision. Coach is watching every day. Coach decision is the top level.
Absolutely.
Yeah, Sarthak. You can come onto the stage and your next talk is.
Have recognized, like being with the Indian ice hockey team and with few Indian players, in our team, we don't have the player with the same skill in enormous. We have very limited players for each role. So whether it is Dhoni or whether it is a striker or a thing. So as a team, when you have been treating as a doctor, yes, we discuss with the physio, we tell them the elements. If you really go personal with the physio, they will say, yes sir, but the coach doesn't understand. But we can't blame the coach because of the limitation and shortage of the players the team has. So that is why at present situation it will change, because now if you see Indian team, cricket team especially, not any other team, we have 3 openers, we have multiple bowlers. That is why India can place 3 different teams, a T20 team, a one-day team and a national cricket team. Now coming to Dhoni, yes, he is the mastermind, he is the brainchild. But if you see Shyam, his position is just as a wicket keeper, so his movement is restricted. He's playing with pain, but yes, he's fit to play because physically and mentally, physically may not be up to the limit, but mentally no one can challenge him. That's what I will say.
Thank you.
But at the end, it's a personal athlete's choice whether to go for the short term, their passion, in compromising their long term health. So obviously they're going to injure that joint, but their short term passion to contribute might be higher. So it's their own decision. Which
so, but the
yeah.
So, but now they say that you have it as a team, the parent or the player, coach, management, everybody give their opinion, team decision, and then allow them to.
And additional to that, actually, we have been discussing about the physical fitness, maybe the brilliance of the player. He may be able to compensate with that, the physical deficit.
Skill level.
That may be one reason why coaches may let them allow to play the games, even in international competitive sports. Maybe physios were not able to pick it up sometimes.
Yeah, that's why it's a team decision. Each one have the expertise to contribute, and then only come to a decision. No, a single opinion might not be more valuable. It's a team which has to decide that. And we must have ears to listen to our other departments also. Probably that's what is required.
Yeah, maybe there's some way it has to be quantified, I know. Some assessment.
Thank you very much, Paul.
Thank you, sir.
Thank you so much.
I invite Dr. Sarthak Patnaik to give the last talk on mental strength, how to cope with physical injury.
Thank you, DVS sir. Thank you, Shyam. Thank you, Santosh. And thank you everyone for attending this conference with such a high number even after post-lunch. Myself, I am Dr. Sarthak Patnaik. I am an arthroscopic sports surgeon. And I was one of the fellow of Dr. David Rajan. And today is such a, I thank everyone for coming. So, if you see this video, you know, whenever a player comes and plays a game, they all tend to win. They love to win the match. They don't care what's going on with the other guy because they have to win and make the other guy handicapped. So if you see, there are two things which goes in this, especially wrestling type of injury. And this lady, she's been so, he just subluxates and fractures the elbow. So what's the physical mentality of these guys? Whether it's a boy or a girl, they just want to win. Whether it is the wrestling for a sports player, you know, his career is over, maybe. Or in the similarly for this elbow thing, also maybe the career. And for a basketball injury, we similarly have certain things in which they go through various multiple injuries in the knees and the shoulders predominantly. So this, you know, when a patients get injured, it is very difficult, you know, to treat them. Yes, it is difficult because we as doctors, we will diagnose, and we might, if needs a surgical intervention, we will surely operate on him or her. You as physiotherapists come into play. Yes, post-op management, post-op rehabilitations, fitness to play, all this fitness to practice, fitness, all these parameters, what all tests we all can do. But what stands more is the two types of recovery. One is physically, another one is mentally. Is he mentally fit? With the limited resources in our country and considering psychology as a social taboo, moment you say, oh, you need a psychological consultation, people think, oh, am I getting mad? Or, you know, why am I going to a psychiatrist? Why am I with a psychological thing? Very few players, I think Coach Sir will also agree to me, really taken psychological assessment. Right, sir? Sir, psychological assessment, post-injury. Very rare, or maybe some don't, because we think as coaches and doctors, this is just a similar injury. But no, this is the two things which needs essential important is physically and mentally mental recover. And why recovering mentally from an injury is important? Because, you know, there is a condition known as post-traumatic stress disorder, where there is an accident. For a sports player, it is the injury which occur on field because he has to go back to sports. That is a trauma for him. For an army officer or an army guy, when he goes to the battlefield and get injured, that is a trauma for him. A guy who as a normal person emits an accident, breaks his leg, amputate, that is a post-traumatic injury. So these are very specific. And second comes the anxiety. Can I make it back to the team? Can I go to the same label? How many months will I take to go to the label? Will I be able to, you know, continue the same form? Will I get my same range of movement? You get tons and tons of questions. And physiotherapists, if you really agree with me, many of the very low players, they won't do the rehab properly. Just like doctors are the bad patients and physios are the bad patients for themselves. They limit themselves. So you think that in 90 days you should get a good range of movement, but they will be lacking. Till this is this time where a psychological assessment might help them and they get the full range of movement. So how can you mentally recover from an injury? You need to tend positive. But what is positive? Who will give them the positive things? What can be positive for them? There are multiple factors. So when you lead a team, when you treat a team, you just don't treat him, you know, at that moment. You have to, somebody has to stay with them day and night. Have a team, have a physio, have a good team of interns who tries to notify them. Suppose I have a track and field owner who is India's 200-meter champion, Amir Malik. Some of the athletes might be knowing. He couldn't go back to his normal level. He was running, his timing of 200 meters was in few seconds, but still then he was not. And he came to my OPD. I saw that is quite vague what complaint he is giving. I told him, Amir, if you agree, I will put my intern with you. He said, okay, sir. So I put my psychologist intern and told him, starting from Amir goes to the field, or he enters the arena till he goes out, you tell me everything. And a proper assessment and history regarding girlfriend, family history, drug abuse, alcohol, type of food, what is his thing. So you need to observe a player very religiously, how he approached to the ground, what dress is he wearing, what is the type, how he is keeping his bag, how is he assessing the thing, how is his ending of his run, how is he starting of his run. Everything has to be assessed. And you know, everything is done. And this assessment we continued for Shyam for 2 months, and then we could get an improvement in 1 second in his running time. That 1 second for a hit or for an athletic is very much. And he was happy and he went ahead and performed and got selected again and is now back in track. So The triangle of success is three things. You have to increase your focus, the preparation, and the execution. So focus, all athlete needs to focus on the aspect of performance. You have to be very focused. You can't just lose your focus here and there. And don't get focused on outcome goals. You know, what am I doing if I'm going to run like this? Whatever thing, just don't think about them. And don't think of other resources. Am I, especially weightlifters and wrestlers, they coach and they think, come to us and they are having this wrist pain, they are having this knee pain, I think this steroid will help. So even if you are a trained, sometimes they take, as a dry needling expert or a wet needle expert, but you have to be very careful because any international player pricking is a crime. You might end up, so you take a proper deep consent. So you keep your focus and tell them before you do any sort of injury, like treatment, that this is what has been done, but whatever treatment you are giving, you can't lose your focus on your game. Then come focus. So how well they know where you want to go, their goals, and how strongly do they believe in their ability, and how much do they really want to get there. So these are the three things which you should ask to the player, like what exactly he or she wants. So these three factors, you should keep it in your center. And when they ask you a question like when can I go, you have to ask them these three questions. And then they give you a time frame. Okay, I have a national meet in this month, I have a normal college meet, or I have a selection. All those things you have to understand. A national meet, you should always prepare yourself. Oh, it's 2 months is very less. Okay, for the next national meet you can be ready. But for the regular local, you have to think. And you should encourage them. So whether you believe or you can't, so an athlete performance is largely a function of their expectations. So the more they expect, it's good for you, but simultaneously you should know where your limitations, and they should always have the self-image. So the daily they should carry the image, and how they should perform it will help them in coming up with the result. So focus on where your comfort zone is not. So when you find out, after questioning all those three things, you should find out where is not comfort, and then you have to put a focus on that. Along with your rehabilitation, we as doctors, sports physios and sports doctors, we have to work together, because we lack one thing in India as a sports psychologist. So once we work together, along with the help of the coach and player, we can come up with a result. So because you need to tell the coach, this is the time where he has to focus. Now there was a cricketer who is Odisha's Ranji's opener. His name was Sambit Patnaik, and he had a fracture of the fifth metacarpal. So though I operated, he's now playing again, but to come back, because he's a slip fielder and he's an opening batsman. When you're a slip fielder, the ball comes in a very big space or high pace. So, they are very scared, but you need to train them again and again. So you need to do as a physio to give them the catching practice, and then slowly you have to break that fear. So preparation, yes, you have to set your own goals as a player, as a physio, and as a doctor. We have to know, okay, this is my long-term goal for this player, this is the short-term goal, and this is the outcome goal. So this is very much essential when you are treating a player. And write down your goals in a diary. So I will request all the players who are at present here, or the physios, maintain a personal diary. I do maintain it specifically till date. That is why I am able to do my specific goals, which will help you in the development of the player's mind and his performance and his level of sports. So what tools you can use? You should have a goal development. You should have the commitment to each other. Pre-shot routine, what routines he should follow before the game. Working diary, which has to be carried daily and all. A proper training plan with the help of the strength and conditioning guys, with the physical trainers, with the coach, with the physiotherapist and everything. And visualization. You need to visualize his present and the past and the present and the future. This is a sort of diary we should mention regarding what were his drawbacks, and then what is his strength, daily strength measured, and then you need to find an average of it. And as I told you, everything has to be included regarding what food is eating, how much time he spends in the bathroom. Why? Because many times, when we are depressed or something, we try to hide ourselves. We spend more time on the pot sheet, or we tend to get on the showers. And we tend to think more on that thing too. So this, what is a goal commitment, which you should ask this question to yourself. What do you expect to gain? What do you expect to lose? And what will be the gain for the important people in your life? What will be the cost, the important people in your life? Is the effort worth it? Why do you want this? And who pays the price? So there's a set of questions, for the goal self-assessment question you should ask. So there are few quotes. Winners expect to win. Winners set the stage. First success, winners know they can control themselves. Winners make winning part of their comfort zone. Winners know what makes them perform well. Winners know how to control anxiety. So everyone know Arnold. We just go in Arnold and say, I don't care what happens. That should be a mental strength. So 10 pieces of advice for the female athletes. Be confident, be strong, be tough, be a student, be thoughtful, be proud, be decisive, be great, be energetic and passionate. And if you have in your flying end of a female athlete, you should have your ambition set high. You can have a career and a family. As an instructor, just imagine Mary Kom, and understand your sponsorship, because a sports person life is very much limited. So you should carry your sponsorship still very properly. Changes in perspective. Recovery is like working out. It requires time, effort, and proper rest. As I told, keep a journal. Start your goal settings. Make new and manageable goals for yourself. Start small and build it up slowly. So stay positive, focus on the things you can control, not unnecessary things. Keep your mentality peace. Find an alternative way for exercise. Find a hobby when you're injured or you're out of the ground, so that it helps you to focus and think. Now, suppose you have injured your lower limb, encourage the guy to play carom board, chess, or some upper body extremities. Don't make him think. Now suppose you're treating a cricket player or a bowler and okay, he has injured, he can't go. Ask him to stay day and night with his ball, so that he don't lose the proprioception in his ball, or he don't use the loose. So you have to think. A guy with a upper limb injury, if he's a football player, you just ask him to go daily and kick inside the room or something like that. Don't take them away from their game. So meditate. Yes, it helps with stress and worrying. And overtraining, there is a complete study, like overtraining can lead to injury. So try to avoid over rehabilitation also in the same thing. So don't isolate yourself, avoid depressive feelings, stay connected with your family and friends, which is very much essential. Just the way now this guy is trying to do, our cricketer who is injured, I'm forgetting his name, the ace cricketer, wicket keeper, Rishabh Pant, yeah. So now the thing, yes, I want to tell this earlier. Rishabh might come out of the injury, but what is exactly worrying, what I was asked, is the post-traumatic stress disorder. That is the thing what he's trying to do, connecting with his players, with his teams, with his follower. Always in Twitter, he's putting his follow. Practice, take a break, if you are out of the game, take a break and do. And this is something very important, the mental imaginary. This is a movie known as Kill Bill, in which sometimes your body doesn't work, and which is where you have to talk to them. I will request all of you to watch this scene of the movie, in which he talks to his toes, which were after a long time in coma. Wake up, my toes. And this is how all the toes started slowly flickering. He got the movement and he went back. So the self-reflection, you should always have this in your life. This is my principle, which I follow till date, is the 3H. Be honest to your profession, be honest to your patient, have a humble background, be humble and always be true, whether you are a player or a physiotherapist or anything, and hardworking. Yes, problem-based focused, and you have to have consistent mental preparation and always have a practice. And your pre-game warm-up, that lady, you must be doing that at home too. So he has the guts to do it on a policeman. So this is another pre-game mistake which we always do. So worrying too much is one of them, and psyching yourself out before the competition, allowing fears of failure to be in the top of the motivator. So this you have to avoid. Meditation, yes, it do help, and but meditation in a perfect way is important. It is not that you are in your own zombie world and this is not proper meditation. So entering a mindful state is very much essential for these things. So pre-performance routines, yes, you have to follow a routine. Are valuable because they take you from thinking on doing something to do it, and change the environment. There is a study which has shown that when you try to recover yourself, your environment depends. So, and the best thing is they have found in the study a green environment or a beach environment. So, unfortunately, we don't have sea here on many parts of India, but yes, there is a forest very close by. So you can encourage your players to, go and run for 10 minutes. And these are some of the example. You can see this is a national level weightlifter. Just see his left shoulder. It goes in a complete tear. And we went and I did a banquet repair, which was with 3 anchors. That's okay. And then post exercise, he started his exercise. Just see the range of movement. And I'm very happy to say that he has gone back to sports. This is another hockey player. She has an ACL tear with meniscus. So we did arthroscopy ACL regression with meniscus repair. But you see, what I did was, whatever I just forwarded is the ACL reconstruction. But I asked her to be with her game. And this is within 3 months. She is doing all the proprioception in the movement. There's not much of knee movement, or not much of the knee ROM has not attained properly, but is still able to and is continuing. This is our rehab setup. So we are maintaining and keeping him along with the sports. So a champion mindset should be always. My last slide, just this.
Will not be in my creed. I will believe where others have doubted. I will always uphold the prestige, honor, and respect of my team. I have trained my mind and my body will follow. Who am I? I'm a champion. I will acknowledge the fact that my opponent does not expect me to win, but I will never surrender. Weakness will not be in my heart. I will arrive at the cutting edge of battle and win by any means at my disposal. I accept the fact that my team expects me to move faster and fight harder than our opponent. Never shall I fail my teammates. I will always keep myself mentally alert, physically strong, and morally straight. And I will shoulder more than my share of the task, whatever it may be, 100%. Who am I? I'm a champion. My opponent may not fear me, but he will respect me. And if he does not, I will make him respect me with all that I have to give. Who am I? I'm a champion. It's our time, not tomorrow, not next week, but right now. None will say I've not given all I have to give, and none will take my glory. Who am I? I'm a champion. History will remember me. No one will deny me. No one will define me. No one will tell me who and what I am and what I can be. Who am I? I'm a champion. Who am I? I'm a champion.
Okay, thank you very much.
Thank you, Dr. Sarthak. Captain, your captain is missing in the introduction. Anyway, just a small introduction about captain is he served the Indian Army, and he has got a very different background, and he still has the bullet wound in his thigh shot by a terrorist, and he has gone through a lot of difficulty in his life, and he's really a champion. Thank you very much. Quickly, we'll proceed to the next live demo session by Mr. Ramakrishna.